afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the Honourable Blaine Higgs, Premier of New Brunswick, and Dr. Jennifer Russell, the province's Chief Medical Officer of Health. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le Premier ministre, l'Honorable Blaine Higgs, et le médecin hygiéniste en chef, le Dr. Jennifer Russell. Premier Higgs.
Good afternoon. Bonjour. Today it is my pleasure to announce our move to the next phase of reopening New Brunswick. This would not be possible without the collaboration of the All-Party Cabinet Committee and the leadership of Dr. Russell and her team. Nor would it be possible without the efforts of New Brunswickers, who have continued to follow the directives of public health and have helped to contain the spread of COVID-19. La situation exceptionnelle peut faire ressortir ce qu'il y a de meilleur chez les gens. Et c'est exactement ce qui est arrivé dans notre province. Tous les membres ont travaillé ensemble pour nous permettre de passer à la prochaine phase de notre plan de rétablissement. Beginning today, we will move further into phase 2, or the orange level, where we will continue to balance the reopening of businesses and activities while actively working to prevent a resurgence of transmission. We began transitioning to phase 2 on April 24th with the introduction of the 2-household bubble. We opened golf courses and driving ranges, allowed recreational fishing and hunting, and encouraged people to enjoy outdoor spaces so long as physical distancing was maintained. We allowed carpooling. Post-secondary students were able to return to campus to fulfill course requirements, and religious organizations were allowed to hold outdoor services in vehicles. Those were our first steps, and because they went well, today I am pleased to announce further loosening of restrictions. Starting today, elective surgeries and other non-emergency health services, including dental, physiotherapy, optometry services, and massage therapy will be allowed. Outdoor public gatherings with physical distancing of 10 or fewer people will be allowed. Les rassemblements publics de 10 personnes ou moins à l'intérieur sont autorisés pour les services religieux, les mariages et les funérailles. Mais il faut respecter les mesures de distanciation physique. Post-secondary institutions may now open subject to COVID-19 directives from public health, including physical distancing measures. However, virtual education options should be continued wherever possible. Among those able to open are cultural venues such as museums, galleries, and libraries, offices not deemed essential during the initial phase, retail establishments, including malls. All of these businesses are expected to follow the directives of public health, including physical distancing. In addition, our government is also requiring anyone who cannot social distance must wear a face mask. Exception would be children under 2 and those individuals who cannot due to medical reasons. Restaurants are also able to open. Like other businesses, however, restaurants must have a plan in place to reduce risk to customers and to employees. Le nombre de clients que les restaurants pourront recevoir en même temps pourra varier selon leur capacité de répondre aux exigences de distanciation physique ou selon leur capacité de mettre en place d'autres mesures lorsque la distance de 2 mètres ne peut pas être maintenue. Les clients qui font partie du même regroupement de 2 ménages pourront prendre place à la même table. When physical distancing cannot be maintained, physical barriers such as a booth should be in place. And face coverings must be worn by employees who must come within 2 meters of each other. Additional cleaning and hand washing is also crucial. Campgrounds and outdoor recreational activities such as zoos and outfitters may open if organizations can ensure physical distancing. Early learning and child care centers regulated by the Department of Education and early childhood development will only be permitted to reopen as of May 19. Le ministère communiquera avec les exploitants pour leur donner d'autres renseignements dans les prochains jours. Les fournisseurs de services de garderie non réglementés trouvent ouverts dès aujourd'hui, mais ils doivent avoir un plan opérationnel et respecter les directives de la santé publique. Day camps can open immediately if the organization can adhere to public health measures set out in the document called COVID-19 Recovery Phase, Guidance to Early Learning and Child Care Facilities and Day Camps. ATV trails can open across the province. Businesses can open effective immediately, but each of them must decide when they are ready to open. Some have been preparing for this moment and will be able to open right away. Others will need more time. Businesses must ensure they have an operational plan in place that adheres to public health and WorkSafe NB guidelines. The operational plan does not require pre-approval, but must be kept on file. WorkSafe NB has developed a template that can assist with plan development, and it can be found by visiting their website at www.worksafenb.ca. This operational plan must be available upon request and can be requested by officials from Public Health, WorkSafe NB, or Public Safety during a scheduled or unscheduled visit. Business owners that have questions can contact Opportunities New Brunswick Business Navigators by emailing nav@navnb.ca or 1-833-799-7966. Les entreprises qui ont besoin de l'équipement de protection individuelle pourront consulter une liste de fournisseurs qui sera disponible sur le site web du gouvernement de Nouveau-Brunswick au début de la semaine prochaine. I've seen the labor force statistics for April that shows nearly 50,000 New Brunswickers are out of work over the past 2 months due to COVID-19. Certainly, reopening businesses will help reduce that number. We also have a number of jobs open in our agriculture and agriculture sectors that need your help. I'm wearing a t-shirt today that says "Stepping Up for My New Brunswick." Faire ma part pour mon Nouveau-Brunswick. This is a phrase you have heard me say over the past several days, and you will continue to hear me say this. We all need to do our part during this difficult time to ensure our various sectors have the workers they require. We are connecting employees with employers. As of yesterday, we have 188 people that have stepped up for their New Brunswick. They've registered on the job matching website. And I want each of them to receive a t-shirt like this, because we're all proud of living and working in New Brunswick, and we're all proud to do our part for our New Brunswick. I'm excited of what I'm seeing as people are coming forward to help our farmers, our fishermen, our processors, and any other activity in a business that's trying to get up and get the feet under them to recover from this COVID pandemic and something that has hit our province so hard. At the end of the day, in years from now, I want us all to look back and say, I was part of the success story for New Brunswick. I was part of helping New Brunswick recover. And so many of my friends, my neighbors, my acquaintances that were in trouble at the time in that pandemic, I helped them to return to a new normal, but to get back on their feet. We can be part of this, and we'll share the victory together. There are many more positions available, so I encourage you to please continue to step up for our New Brunswick. So far, 54 employers have registered. A virtual job fair is scheduled for next week. More information about the job fair is available at workingnb.ca/travailnb.ca. Depuis le début, notre objectif est de faire tout ce que nous pouvons pour contenir la propagation du virus, afin que notre système de santé ne soit pas surchargé. Jusqu'à maintenant, nous avons atteint cet objectif et travaillons ensemble. This is how we'll continue to find success today, and in the days ahead. By each of us stepping up for New Brunswick, we will indeed continue to go forward, and we will beat COVID-19. Thank you. Merci.
Thank you, Mr. Premier. Merci. Good afternoon, everyone. Bon après-midi à vous tous. So here we are. This is a very important day. We are about to embark on a new phase of our journey together, collectively. Alors, c'est une journée très importante aujourd'hui parce qu'on est prêt à partir sur la prochaine étape de notre voyage collectif ici au Nouveau-Brunswick. Alors, le Nouveau-Brunswick va de l'avant. Nous poursuivons aujourd'hui notre chemin dans le processus de rétablissement en franchissant les prochaines étapes vers la nouvelle normalité en ce temps de pandémie de COVID-19. Nous continuons d'aller de l'avant, même si nous savons fort bien que le virus est encore parmi nous et qu'il le sera encore pendant un certain temps. New Brunswick is moving forward. We are today continuing along our road to recovery, taking the next steps in our journey to the new normal in this time of COVID-19. We are moving in the knowledge that the virus is still with us and will be with us for some time to come. We are moving with an understanding of how we can slow the spread of the virus and deal with new outbreaks as they occur. We are moving with a determination to keep everyone healthy and safe, to protect our healthcare system and those who work in it, and to shelter our most vulnerable residents from the worst effects of this disease. We have assessed the risks and the steps we are taking today. But there are risks, as there are in anything that we do. And if this makes you nervous, I get that. It makes me nervous too. I used to have a fear of flying, and when I was in the military, I wanted to take a course called the Flight Surgeon course, which is where you learn about aerospace medicine and learning the effects of flying and how to take care of aircrew. And I told a little white lie that I did not have a fear of flying so I could get on this course, because I really, really wanted to learn this particular area of medicine, because you had to fly with pilots and aircrew for a bit to learn what they did and be able to look after them properly. So we are on this adventure together, and yes, I get that it's nerve-wracking and it can cause some anxiety. And as anxious as I am about the impact of opening up, I'm just as concerned about what happens if we don't open up. My job is to improve, promote, and protect the health of New Brunswickers. And I need to think about all of the things that make New Brunswickers healthy. There was actually a tweet today on Twitter from the New Brunswick Health Council that really illustrated in a beautiful graphic that all the different things that contribute to people's health are very important. So the socioeconomic impact on someone's health, personal individual behaviors and their impact on a person's health, the healthcare system, their environment. All of these things are really important when we're focusing on the population health. And our focus has been protecting people in our healthcare system from COVID-19. And we have all done that very well. And so we are at a stage now to balance the risks and consider the full impact of our social, economic, and mental well-being. Bien que nous devions demeurer vigilants pour prévenir une résurgence de la transmission de la COVID-19 dans la province, nous devons aussi trouver un moyen de reprendre notre vie quotidienne dans le contexte de notre nouvelle normalité. Nous ne pouvons pas nous cacher de cette maladie. Nous devons apprendre à vivre avec ce virus. 2 weeks ago, the Premier announced the first stage of New Brunswick's recovery plan. This was designed to begin the reopening of our province after 6 weeks of restricted activity with some relatively low-risk actions. And since that announcement, we have had only 2 cases of COVID-19 and the recovery of every person who has had previously tested positive. In that time, we have discharged all COVID-19 patients who were being treated in the hospital. And thankfully, we have seen no deaths from COVID-19 in our province. These results have given my team the confidence to government's move to the next level of our recovery plan. In this new phase, which takes effect today, many of the restrictions set by the state of emergency will be lifted. But we are not returning to life as it was before the pandemic. That normal is still a long way off. Maintaining physical distance from others and continuing to practice good hygiene will be vital in this new normal. And when you cannot maintain 2 meters of physical distance, wearing a community face mask that covers your mouth and nose will be required. The only exemptions will be for children and any other person who has trouble breathing or is unable to move their mask without assistance. Masks should not be made of plastic or other non-breathable materials, nor should they be made of materials that easily fall apart, such as paper tissues. Masks should not be secured with tape and must not impair your vision. And under no circumstances are you to share your mask with any other person. Individuals who can't find or buy a mask may use cloth community masks that require no sewing, which can be made from common materials such as cotton bandanas or t-shirts, and using elastics, rubber bands, string or cloth strips or hair ties to secure it. If the curve stays flat, in a few more weeks, we may be able to announce the lifting of these restrictions. I'm hopeful that we will be able to continue to move in this direction, but whether that happens is largely up to you. We are able to remove further restrictions because of the actions that New Brunswickers have taken to slow the spread of COVID-19. Pour que nous puissions continuer à avoir d'excellents résultats, vous devez continuer à faire ce que vous faites depuis le début. Veuillez continuer à avoir des contacts étroits seulement avec les personnes qui font partie de votre bulle de 2 ménages. Continuez à éviter les rassemblements publics. Ces actions qui vont limiter les nombres de contacts étroits s'il y a un cas de COVID-19. Continuez de bien vous laver les mains fréquemment. Toussez ou éternuez dans votre manche et évitez de vous toucher le visage. Assurez-vous de nettoyer les surfaces fréquemment touchées, comme les poignées de porte et les comptoirs. And if you experience even mild symptoms, and this is so important moving forward, have a very, very low threshold for calling 811. Have a low threshold of staying home. Before COVID-19 happened, I know many people would go to work when they were not feeling well. They would go to work and push through it thinking, no, I have work to do and I can't let my colleagues down. You will be letting New Brunswickers down if you go to work with symptoms. Have a very low threshold to get tested for COVID-19 and call 811. This is what is going to allow us to continue lifting restrictions, to continue functioning in our society and having an economy that's functional. So again, have a low threshold for contacting your primary healthcare provider and calling 811. These actions will save lives. And again, with the issue around social determinants of health and all of the things that impact the economy and our society, things that happened during the first level of restrictions in COVID-19 that were very, very difficult, all of these things that impacted mental health, all the things that impacted isolation, all of these things were very, very difficult. And so moving into this next phase, we just want to be cautious and we want to do things safely. As Chief Medical Officer of Health, my team and I will closely be monitoring the new situation. If we see a spike in new cases or an outbreak that cannot be readily traced to existing cases or receive new evidence that requires action, I will not hesitate to recommend the reimposition of stricter measures. We are all learning together. There is no roadmap for success at this point in time. We have to trust that the information that we are basing our decisions on today is the best information that we can make our decisions on, that it's based in evidence and science. This may be done at a local or regional or province-wide basis as circumstances dictate. And again, I'm in touch with my colleagues 3 times a week at the national level with a special advisory committee and all the chief medical officers of health of the country. For those who feel anxious about this, I share your feelings. This next step may be difficult for many of you. À la suite de près de 2 mois de restrictions, je sais que de nouveaux citoyens du Nouveau-Brunswick ont hâte à tenir des rassemblements sociaux, de voyager et d'avoir des contacts étroits avec les autres. Il se pourrait que nous voulions maintenir nos distances même après que les contacts étroits ne soient plus dangereux. We may become frustrated, impatient, or angry with others who are moving more quickly to embrace the new normal. But that's why we need to be kind to one another. Some of us may need more time and more support than others, and that's okay. Anxiety is not a personal failure or a weakness. It is a normal human response to genuinely frightening times. And I did read an article the other day that likened the stages of the pandemic to the stages of grief. So we are cycling through those stages together, and we do really need to be mindful of those effects as we move forward together. If we can view our anxiety and that of others with compassion and understanding, as well as compassion for ourselves, we will experience less suffering through the weeks and months of uncertainty to come. Please reach out for help. Please reach out for support and encourage others to do the same. Please check on your friends and family and colleagues. New Brunswickers are perfectly designed for this. We are known for being kind and compassionate. We know how to take care of each other. Nous savons comment prendre soin les uns des autres. Nous arriverons à traverser cette épreuve ensemble. What I can guarantee is that there are no guarantees. COVID-19 is here to stay. And honestly, I have a very healthy respect for this virus, as you should. We really, really need to stay vigilant. We really, really need to keep doing what we have been doing that has allowed us to be successful thus far. And moving forward, that success will look a bit different because we will be learning to live with COVID-19. I can tell you that the Premier and I are committed to working as hard as possible so that we can have a functional society and an economy in the safest way possible. And I need all New Brunswickers to make that same commitment. Thank you. Merci beaucoup.
Thank you, Dr. Russell. Thank you, Premier. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste aura une question. Vous avez le droit de poser vos questions dans la langue de votre choix. We will now proceed with questions from the media. Each reporter will have one question. You have the right to pose your question in the language of your choice. Inda Intiar, Huddle.
Hi, this is a question for the Premier. Yesterday, the federal government announced funding to top up wages for essential workers. What's the province's plan for that, and who would that cover?
So the Prime Minister made it clear that he was looking at, they had a wage cap on it. I think his comments were anyone that was making certainly minimum wage or less would qualify. The number was like $2,500 a month, I believe. So we've been going through our categories in the province and in different sectors of essential workers that were actually stepping up, if I use the word, during this pandemic, and were part of the essential workers that were involved. I mentioned a week or two ago, earlier this week, that I would be bringing forward a plan for New Brunswick within the next couple of weeks. So that's still the target. We would be doing that, as I say, within 2 weeks.
Thank you, Ms. Intiar. Emma McPhee, Telegraph Journal.
Yes, hi. I have a question for the Premier as well. East Coast Ferries is saying that they haven't set a date for when the Campbell Ferry will reopen. So I'm wondering where the June 29th date came from, and if you actually know a date now of when it will be reopened.
So the date of June 29th was based on kind of the original operation and what the intent was for normal operation. I have asked for an earlier date, and is it possible, is their equipment ready to do that? And I have not got an answer on that yet, but that's still pending. So if we can put them in service earlier, if they're able to do so, we've requested information in that regard.
Thank you, Ms. McPhee. Nicholas Steinbeck, Radio-Canada. Silas Brown, Global TV.
Hi, Premier. When you look at what we're getting today, there's quite a lot of trust being placed in New Brunswickers today, particularly when you look at the things around, 10 people outdoor gatherings and that sort of thing. What do you have to say to New Brunswickers who are maybe considering, well, why can't that be 15? Why can't that be 20? And why can't we do that inside, and are going to be looking for ways that they might potentially be able to bend the rules here?
Well, I guess, much of this is based on individual and personal convictions. This isn't about trying to, not get a speeding ticket or trying to find a way around the law. This is about protecting your neighbors and your parents and your grandparents and your friends and relatives across the province. So it's a different commitment. It's a personal one that you can think about and say, can I do my part here? Can I help? And that's why, you know, you're absolutely right. These are things here that are going to be very difficult to enforce. We will be looking at, you know, activities and understanding, particularly businesses that are opening or gatherings that are visible. But we are imploring the citizens of this province to be part of this continued success story. We have a situation in New Brunswick that's being watched closely from across Canada. I would say, and I'm sure Dr. Russell would concur with me, that we have seen tremendous support throughout our province to be at this level. That support needs to continue. I think our province will rebuild better, stronger, higher level of conviction from our residents and a future that's much brighter for generations to come.
Thank you, Premier. Thank you, Mr. Brown. Elizabeth Fraser, CBC.
Hi there, my question is for the Premier. I'm just looking for your response to the story today of a Toronto man whose father says he was trying to move to the province but told peace officers he was visiting his parents and then was eventually taken into custody, fined, and sent back to Toronto.
Well, yes, and I learned of that. I don't know all the details. You know, I've been very supportive of our compliance and safety officers throughout this entire COVID-19 ordeal. And, you know, I have said, and Dr. Russell has said, how important it is for border security. I mean, it's more important now than ever as we open up more in our province and try to rebuild our economy. So from what I can understand, it is a most unfortunate situation. You know, if indeed someone, you know, and someone is moving back home to be a resident here in New Brunswick, then it's easy to get permission. It's easy to understand to do that. It's easy to be able to have the right criteria when you arrive at the border or when you arrive at the airport. So it is unfortunate. It's again, I just say we've asked officials to guard our borders, to keep our citizens safe, and that's what they're doing. And they're following the same rules in this situation as they've been following for the last 2 months. So I'll be interested to learn all the details. I think everyone knows the situation the province is in. Anyone knows we're restricting people coming in and out of the border, so it has to be very clear that you're coming here for a purpose. A visitation is not one of those purposes.
Thank you, Ms. Fraser. Thank you, Premier. Matthew Wacomo, l'Acadie Nouvelle.
Bonjour, ma question est probablement pour Dr. Russell. Pouvez-vous nous expliquer la logique derrière l'idée d'autoriser les rassemblements de 10 personnes à l'extérieur, mais pas encore à l'intérieur?
Alors, les discussions qu'on a avec les médecins hygiénistes en chef des autres provinces et territoires au niveau national, on identifie des risques pour toutes sortes d'interactions. Alors, si c'est quelque chose qui se fait en hors, puis vous pouvez maintenir le 6 pieds de 2 mètres de distance entre les gens, ça, c'est quelque chose qui a moins de risques que s'ils sont dans votre maison, s'ils sont dans une bâtisse, parce que si ça arrive qu'il y a plus de chances qu'ils vont toucher des surfaces, ils vont aller aux salles de bain, ils vont toucher de quoi, et le risque est plus haut à l'intérieur. Et je crois que même être capable de maintenir la distance de 2 mètres à l'intérieur, c'est difficile aussi. Et n'importe quand que vous avez de quoi manger, de quoi boire, les choses comme ça, le risque augmente aussi parce que vous touchez plusieurs de choses. Et après ça, vous touchez votre face et après ça, vous êtes infecté. Alors, ça ne prend pas beaucoup de temps puis ça ne prend pas beaucoup d'interactions pour avoir le risque de transmettre le COVID-19 à quelqu'un. Alors, le risque est plus bas. C'est comme ça, on l'a discuté au niveau national. Le risque est plus bas à l'extérieur. Alors, c'est pour ça que les directives sont écrites comme ça.
Merci, M. Wacomo. Laura Brown, CTV.
Hi there. I'm wondering, I was a little surprised that restaurants do not have about 50% capacity, I guess, measurement on them and other office uses. Was this considered, and how would you foresee restaurants being able to maintain things like physical distancing? What guidelines would you give them?
So we know that in other jurisdictions it is possible. So in our guidelines, we do have the direction around social distancing and how restaurants can do that. Again, there are ways of doing that. It will obviously affect the capacity that a restaurant will be able to absorb and to host. So again, with all of these things in place, then that is the safest way to be able to operate. But we would not encourage anybody to be open and operate without all of those physical distancing pieces in place ahead of time.
Thank you, Ms. Brown. Thank you, Dr. Andrew Watt, Telegraph Journal.
Hi. My question is to, well, either the Premier or Dr. Russell. Originally in the Phase 2 documents, there was a reference to visits to vulnerable populations under strict controls. Is that in effect now, and what does that actually mean?
So independent of the colors, the task force, the pandemic task force has met several times on this topic. There's also a working group that works on the topic of all vulnerable populations. And as a result of one of the meetings at the task force where we were consulting with a specialist in Quebec by the name of Dr. Liu, who used to work for Médecins Sans Frontières, we talked a lot about the compassionate issues around dying alone. And so independent of the phases that we are in now, we do have a newly released policy around visitations for palliative care patients. Whereby I think at one point only one person was allowed, and it was in certain settings, perhaps in the hospital settings. But now our new policy will include 2 people who can visit, whether it's in a hospital setting or a nursing home setting. This is very new information that hasn't been operationalized yet across the different partners. So again, independent of it's a bit coincidental that it's happening at the same time that we're announcing this phase, but those conversations have been in the works for quite a while. But yeah, so I don't think that it will be able to be operationalized right away, but definitely for compassionate reasons, we will be allowing visitation to palliative care patients. But in our guidelines, the guidelines specify that if you've traveled outside of the province, you must self-isolate for 14 days prior to that visit. And once you choose the 2 people that are going to be visiting you, they have to remain the same 2 people.
Thank you, Mr. Watt. Michel Corriveau, Radio-Canada.
Bonjour, merci Bruce. C'est une question pour Dr. Russell. Dr. Russell, j'aimerais que vous nous expliquiez pourquoi c'est prudent à ce stade-ci d'ouvrir des milliers de restaurants, de commerces avec les emplois qu'il va y avoir dedans, peut-être pas des milliers, des centaines, mais des milliers d'employés. Alors donc, pourquoi à ce stade-ci, vous estimez à la santé publique que c'est prudent d'aller de l'avant?
J'ai pas entendu toute la question, Michel. Tu peux répéter? C'est difficile d'entendre parce que le volume est pas très haut.
OK. M'entendez-vous comme ça, Dr. Russell?
Oui.
OK. J'aimerais savoir que vous nous expliquiez pourquoi vous estimez que c'est prudent à ce stade-ci d'ouvrir des centaines de restaurants et de commerces où il y a des milliers de travailleuses et de travailleurs.
Alors, le risque pour ouvrir n'importe quel établissement, il y a toujours des risques quand il y a des patrons. Comment les patrons interagissent avec les employés, comment les employés interagissent avec eux-mêmes. Tout avec la distanciation physique, ça devrait être en place et tous les établissements devraient avoir un plan. Il y a des formulaires qui sont fournis sur notre site web à l'aide de WorkSafe Nouveau-Brunswick pour aider à avoir toutes les choses en place qui devraient être en place avant d'être ouverts. Alors moi, aujourd'hui, le message, c'est oui, vous pouvez ouvrir, vous avez la possibilité d'ouvrir, mais vous ne devrez pas ouvrir avant que vous avez votre plan tout développé et vous avez mis en place toutes les choses pour protéger les employés et les patrons au niveau de distanciation physique.
Merci, M. Corriveau. Adam Harris, Telegraph Journal.
Thanks, Bruce. Question for the Premier. On the unemployment numbers, I wanted to know what you think needs to be part of a recovery plan, and whether or not that includes an infrastructure stimulus plan or competitive business taxation or anything in particular.
Well, yes, it does require a lot of particular concerns. In my discussions with the federal government, what I've been asking for has been flexibility, and we've been asking for that as all First Ministers across the country. Flexibility in the current money that's there in the federal infrastructure program. I think we have like a $500-600 million that's there, and if I used an example, 165 of that is designated towards transit. Now, I can understand how that that's 165 million. I can understand how that would work, transit for maybe Montreal or Toronto, but it isn't something that is, at this point, is something we could particularly use right now in New Brunswick. So I've asked for flexibility so that we can put money towards things we really need, and that would be maintaining, whether it be schools, whether it be hospitals, roads, bridges, things that are needed to be upgraded, and so we get a higher level of capability or capacity within our existing framework of government services. We've got a little movement on that, I think like 10% of our total, but it's not going to be anywhere near what could be helpful in this situation to make our money go further. And the reason that I certainly push that way is that I've watched many people look at, okay, well, how much money can we spend today? And that's fine, and I could do that too. And maybe at this point in my life, that won't make a difference. But when I look at a lot of people that are younger than I am, and I'm thinking, what kind of New Brunswick are they going to have in the next 5 or 10 or 15 years? And if I spend all of the money today, what's it look like going forward for New Brunswick? How do I make sure that where money goes, it's needed? What's going to happen to transfer payments when one of the main contributors to the transfer payment system, Alberta, their economy is just non-existent to what it used to be? So we need to think of all of those things as we move forward. If New Brunswick had a significant cut in transfer payments, us with about 30% of our budget, or like $3 billion is related to federal transfers of a $9.5 or $10 billion budget, that would be huge for us to be able to manage. So for me, this is about not only building and bringing up in the economic recovery, but it's doing so in a way that next year we're still on a road to recovery. We're not wondering what happened next year because we completely blew our wad in the year before. So I'm working with every business to do what's necessary to help them get back on track, but to ensure it's a sustainable track.
Thank you, Premier. Thank you, Mr. Harris. Geneviève Normand, Radio-Canada.
Yes, so my question is for you, Premier. I was just wondering, the federal government yesterday announced funding to boost the salaries for essential workers. So I was wondering, but the decision has to come from provinces. So I was wondering if you have decided which category of workers would receive such funding here in New Brunswick.
Well, certainly, we are working with under the federal guidelines in that regard. They capped it at $2,500 a month. It's more like I think the minimum wage category that the federal government would participate in. So we're going through that list now and defining that where do our essential services workers fit in that category, and who was working during this pandemic, who were going above and beyond during this process, so that we ensure to recognize those that have, put themselves out there. And as I've spoken earlier today, that they have shown that they have not only stepped up for New Brunswick, but they continue to step up for New Brunswick.
Thank you, Premier. Merci beaucoup, Madame Normand.
I would just
Vicky
have a quick
Hogarth.
follow-up, if I may.
No, you don't. Sorry. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is either for the Premier or Dr. Russell. Given that many public washrooms are still closed and that hand washing is our best defense, will you be setting up any hand washing stations for the public, or how will you be ensuring hygiene can be maintained?
At this point in time, I'm only aware that whatever establishments and businesses are opening up will have, they're in the guidelines that are going to be on our website, will have specific cleaning information for each, for businesses. So I don't have any other information around hand washing stations at this time, but certainly any of the businesses that will be opening up will have cleaning guidelines on the website for that, for their information.
Thank you. Thank you, Ms. Hogarth. John Chillibeck, Brunswick News.
Yes, thank you. This question is for Blaine Higgs. I was talking to Premier Dennis King yesterday, and he was hopeful the border between PI and New Brunswick could open, by July 1st. How important do you think that would be for New Brunswickers to see that border open?
Well, I think it's a balanced decision between our two borders. I think it'll benefit both provinces. I think that there's people certainly from the island that come to New Brunswick and travel or to shop in their province, and for healthcare services as well, although those would be essential services in any case. We've had discussions, Premier King and I have had several discussions on this, and we're both tracking as we open up to see where things move, and do our conditions remain the same during the recovery path. So I think that as long as that continues like that, we'll continue to talk, and he and I both, we talked around what the date might look like, and I think, getting well into June, end of June timeframe, early summer is, if all things remained equal, is a consideration. We've talked with public health as well, and I think they've had their colleagues talk back and forth. But it's early yet, but I guess if we're going to bubble with any province, that would be a bubbling province.
Thank you, Mr. Chillibeck. François Leblanc, Radio-Canada.
Oui, c'est une question pour le Premier ministre. C'est juste comme une précision. Les gens les entreprises, les commerces qui doivent mettre toutes sortes de mesures en place, est-ce qu'il y a une aide financière pour les aider à passer de mettre des plaques de plexiglas, par exemple, ou d'avoir d'autres sortes de mesures comme ça?
Well, saying that in terms of every business is different. I know that the government has set up a website so that, because we were being asked questions about where to find supplies. I know we've seen directives from the Chamber of Commerce that have basically laid out where supplies can be found. I put this all in perspective of the bigger picture. If businesses are able to, find equipment, we want to help them find the right equipment. We want to help them make sure that they're following the rules of public health. At this stage, we're hoping that businesses will be able to find and do the measures as they need with minimal expense. I know that's maybe not be the case for everyone, but we're hopeful that'll be the case. And we'll work with each business to determine what's feasible for them. But there isn't a plan right now for like a wholesale supply of these sort of equipment requirements.
Merci, Monsieur Leblanc. Sarah Seeley, Times and Transcript.
Thanks, Bruce. My question is for Dr. Russell. I was just wondering what the health and safety guidelines for daycares will be and when this information will be communicated with daycare operators.
My understanding is that the information is going to be on our website today. And we have had engagement sessions with education already and early childhood. So there has been a lot of information and conversations that have taken place already, but the actual information for providers will be on our website today, is my understanding.
Thank you, Ms. Seeley. Carla Rennick, Global TV.
Hi, I have a question for the Premier. I understand you're awaiting more details regarding the Ontario man being turned back at the airport. Can you just confirm that if the proper paperwork is provided to indicate he is moving, will this man be allowed in the future, and what is the required paperwork or documentation that he would need?
We have not refused anyone who's been moving here permanently into New Brunswick. I mean, that's been the protocol from the very beginning. We've had situations, obviously where students have been away at university and have come home for the summer to work here, to be here all summer, which is quite a typical process for students to spend wherever their university, but then to come back home for the summer to work. So this situation, I mean, if the verification was there, that the individual was actually moving from Toronto and moving here to live with his parents, or had an address to live here, and that was the plan, you know, I'm sure that we could work through that. And the idea is in relation to our rules that are on our website. Certainly, there's a number there. There's to call to get information on what particularly is required. But you know what we have said and what we've been clear from the very beginning is that it's if you're moving to New Brunswick and there's an isolation process, then we're able to work through that. But if we're just visiting, this is not the time to visit.
Thank you, Mr. Rennick. Sophie des Hôtels, Radio-Canada.
Oui, bonjour. Ma question pour le docteur Russell. J'aimerais avoir une clarification. Les rassemblements de 10 personnes ou plus ne sont pas permis à l'extérieur, même en respectant la distanciation sociale, sauf pour des funérailles ou des mariages à l'intérieur, je veux dire. Alors, comment se fait-il que les restaurants et certains commerces peuvent, dans ce cas-là, ouvrir et accueillir plus de 10 personnes en même temps?
Alors, dans les restaurants, eux, ils ont la capacité et la possibilité d'avoir des inspecteurs pour faire certaines qu'ils suivent les directives. Alors, les choses qui sont faites par des citoyens privés, il n'y a pas de niveau d'inspection ou de rassurance qu'on peut avoir un garantie pour se faire sûr que c'est fait dans une manière qui est sécuritaire. Alors, la suggestion, c'est oui, tu peux avoir un funéral ou quelque chose comme ça, mais on encourage que c'est pas quelque chose qui sera trop longtemps et c'est vraiment seulement pour les cérémonies religieuses comme ça.
Merci beaucoup, Docteur. Merci, Madame des Hôtels. David Coach, Times and Transcript.
Yes, hi, question for the Premier. So restaurants are being allowed to reopen. Restaurants Canada, the industry association, says that many restaurants operate with both a restaurant license and also a lounge license for a lounge where minors are not permitted and liquor can be served without a meal. In other words, a kind of bar. You previously said that bars won't be a reopening in this phase. Is that still the case, and does that mean that these lounge sections of restaurants will be off limits even as restaurants struggle to operate at reduced capacity?
So I hear what you're saying in terms of distinguishing between the two. My understanding is here in New Brunswick, the type of license that is provided, I don't think it actually matters. It's really around what is the purpose of your establishment? Do you have seating available for patrons? Can you confirm and guarantee that there will be social distancing? So it's more about the purpose and the actual layout of of the business, as opposed to the definition of what kind of license it has. So when we're talking about restaurants, we are really talking about establishments that have seated areas that can guarantee social distancing, and so that's, and again, my understanding is that there isn't a differentiation in terms of the type of license. It's really about the purpose of the establishment.
Thank you. Tom Bateman, Times and Transcript.
Oh, good afternoon, Dr. Russell. We heard from your counterpart on PEI, Dr. Morrison, that fentanyl has been found in street drugs in that province, and there's been several overdoses. Has there been a similar discovery in this province? And I hope that you can speak briefly to what's known about where this drug is originating from. Is it coming over our border somehow, or is it being manufactured here? Thank you.
So the only information that I have on that is that our latest reports really don't indicate that there's been a change in the trends. The trends that we have here in New Brunswick are similar to those that we saw last year.
Thank you, Mr. Bateman. Mia Urquhart, CBC.
Thank you, Bruce. My question is for the Premier. If daycares don't open until May 19th, what are parents supposed to do if their workplace opens before then?
Well, I think there has to be a coordination here, obviously, but we wanted to be sure that daycares were ready to go. And this announcement today gives them time to do that. Some may be able to open sooner, like some of the unlicensed daycares that are available. But I think at this point, you know, people are going to have to, they've been looking at home, and they've had the responsibility, I guess, with their children up to this point, and that'll continue, and if they can't return to work because of the lack of daycare, then maybe it's put off till the 19th. But I think that there will be ways found by every individual case, and worst case is May 19th.
Thank you, Ms. Urquhart. Colin McPhail, CBC.
Hi, thanks, Bruce. This is a question for Dr. Russell. There doesn't appear to be sector-specific recommendations provided for business in developing the mandated operational plan. Why is that, and are you concerned that the level of controls might vary between similar type businesses?
That is also a good question, and really there are about something like close to 60,000 businesses in this province. And for us to be very prescriptive around each and every type of individual business would be very challenging. So working with WorkSafe New Brunswick and Public Health, we have put together the documents so that they're broad enough that they can be applied across different sectors. There is a navigator phone number that we will have that is available. So every single business that does have questions around this can contact and have their questions answered through this navigator. And we've had engagements with every different sector. So these engagement sessions have been taking place all week, and so each of these sectors has already had some one-on-one FaceTime with WorkSafe and Public Health to look at some of these issues in a broad sense. But moving forward, again, it would be impossible for us to be prescriptive for each and every type of business and organization. So these broad concepts can be applied across the board, and if there are specific questions that need to be answered, they can contact the navigator.
Thank you, Doctor. Thank you, Mr. McPhail. The Premier would like to go back to the question and see if there was a clarification from Geneviève Normand. Madame Normand, as-tu une clarification pour le Premier ministre, s'il vous plaît?
Yes, Premier, thanks for allowing me to jump back in. I was just wondering how likely we're going to see the closure of the provincial borders with PEI. Are there any talks right now about lifting that provincial border?
Well, yes, there are talks. We've been discussing back and forth for me with the Premier, Dennis King, and I believe Public Health have been doing the same. But this isn't anything that's going to happen in the next day or two or week or two or even month. We'd be looking at likely the end of June or early July, but it'll depend greatly on the way we open up together, what activities we see as we open up, and if indeed the results from both provinces remain similar in relation to the COVID pandemic.
Thank you, Premier. Thank you, Ms. Norman. That concludes today's update. Thank you. Voilà la fin de notre mise à jour. Merci beaucoup.